This child looks healthy, but he has a hereditary condition called hemophilia. This means he doesn't have enough factor VIII protein for proper blood clotting. To live a relatively normal life, he needs factor VIII replacement therapy. Simoctocog alpha is a new generation recombinant factor VIII, similar to human factor VIII. Factor VIII protein plays an important role in the coagulation cascade leading to clot formation. Factor VIII circulates in the bloodstream in an inactive form, bound to a protein called von Willebrand factor. In response to injury, factor VIII is activated and separates from von Willebrand factor. Activated factor VIII can then allow the coagulation cascade to proceed, leading to the formation of a blood clot. Factor VIII is a large complex glycoprotein that undergoes a process called post-translational modification within cells before being released into circulation. Sometimes the body recognizes infused factor VIII as foreign and develops inhibitors or neutralizing antibodies. Anti-factor VIII antibodies, once bound to factor VIII, stop the factor VIII from working. Immunogenic markers attached to proteins during post-translational modifications, such as the non-human glycan alpha-gal, can increase the response by identifying proteins as foreign to the immune system. Two types of post-translational modifications, or PTMs, are important in factor VIII: glycosylation and sulfation. PTMs are species-specific and are dependent on the cellular machinery of a particular cell type. Glycosylation is the addition of specific sugar molecules to a core oligosaccharide that is attached to the protein. Simoctocog alpha has a similar glycosylation pattern to human endogenous factor VIII. Non-human mammalian expression systems, such as Chinese hamster ovary or baby hamster kidney cells, can produce glycans different from those produced in humans. The glycans N-glycolylneuramic acid and alpha-gal can be present. By using a human cell line, we avoid having immunogenic glycans such as alpha-gal. The second crucial factor VIII PTM is sulfation. The sulfation of tyrosine residues, particularly at tyrosine residue 1680, are necessary to ensure binding of factor VIII to von Willebrand factor. Von Willebrand factor-bound factor VIII is protected from degradation, and factor VIII bound to von Willebrand factor may reduce the risk of factor VIII inhibitor development. Simoctocog alpha is fully sulfated at tyrosine 1680. The sulfation pattern across the 6 key residues is comparable to endogenous factor VIII. The half-life of Simoctocog alpha is 17.1 hours. Simoctocog alpha has been developed to provide a new therapeutic option for hemophilia A patients. Post-translational modifications of Simoctocog alpha are similar to endogenous factor VIII from healthy subjects. Antigenic glycans seen in recombinant factor VIII expressed in hamster cell lines are not present. Simoctocog alpha is fully sulfated at tyrosine 1680, which is important for the binding of factor VIII to von Willebrand factor. This allows the half-life of Simoctocog alpha to approach the half-life of von Willebrand factor. Simoctocog alpha, a new generation recombinant factor VIII, for his lifetime of treatment.